Hello again, welcome to part 2 of today's mini lecture on pathways to licensure. One of the reasons that this is important in a course such as Introduction to Substance Abuse is because that this course is the foundation for your continued studies in addiction and alcohol and drug counseling. It's also important to go over pathways to licensure so that you understand what path that it is you would need to take if this is a specialty area that you were interested in training in. So where we left off was we were beginning to discuss what is the alcohol and drug counselor certification tier. So that's tier 2, and that comes after you've completed the requirements for the AAP certification. So let's say, for example, there is a person who has gotten hired at somewhere like BART, for example, and they've completed all of their requirements for the AAP certification, and now they're working on the certification for being an alcohol and drug counselor. So the cool thing about this tier is that a person does not have to have a master's degree completed at this time. A person can pursue certification as an alcohol and drug counselor with a bachelor's degree. So what is the difference between the AAP and the tier 2 of the alcohol and drug counselor process? So the difference is that a person has to have completed 300 hours of education related to substance abuse treatment. And again, some of the requirements that we discussed for the AAP also apply, as far as things like prevention and recovery not being counted. So, what are the 300 hours of additional substance abuse education that are required for this level of certification? So, they include the following categories, and I will just be giving you the titles of the categories. If you are interested in reading the entire description of each category, it can be found, all of this information, beginning with the AAP on page 7 of the link provided in Moodle for the rules from the Vermont Secretary of State Board of Professional Regulation. So the hours include 6 hours of human development studies, 6 hours of multicultural diversity studies, 6 hours of engagement strategies and motivational interviewing, 6 hours of substance abuse screening, 6 hours of study related to the DSM-5 or its successor, specifically on the substance use disorders and co-occurring disorders. Another 6 hours of study related to the ASM criteria, the American Society of Addiction Medicine criteria. 6 hours of case management service coordination, 6 hours of neurobiology of addiction and substance use dependence, as well as an additional 36 hours of substance abuse counseling and treatment, 6 hours of comorbid, otherwise known as co-occurring medical disorders, 6 hours, which we discussed already, of professional ethics and responsibilities, which does have to be renewed every 2 years once you've received your certification and or your license. Another 12 hours of studies related to medication-assisted treatment, 12 hours of clinical assessment and treatment planning, 12 hours of studies related to relapse prevention, which this is the exception that I referred to in the previous video. Although other courses related to prevention do not count towards certification or licensure, 12 hours of relapse-specific prevention are required. 12 hours of criminal thinking studies, 12 hours of co-occurring disorders, in addition, 24 hours, of co-occurring disorders. This would be the mental health disorders, versus the 6 hours of comorbid medical disorders study. So a comorbid medical disorder would be like someone who has opioid use disorder as well as HIV that they acquired through needle use, for example. Whereas co-occurring mental health disorders would be like someone who has alcohol use disorder and schizophrenia at the same time, or someone who is bipolar, ADHD, borderline personality disorder, coupled with a substance use disorder. PTSD coupled with stimulant use disorder or opioid use disorder, for example. And another important category is trauma. So there's also 24 hours of required education in trauma. So the cool thing about learning about all of this now is that if you are interested in pursuing licensure as an alcohol and drug counselor, if this is a passion for you, then you have the answers now to plan out your course of action for the next 4 to 8 years of your academic and professional career. Which may sound like a lot, but I would definitely recommend that during the first few years of your undergraduate college experience that you definitely explore, what are the options, what are the specialty areas within the field of psychology and human services. The other cool thing about knowing all of this now is that as you plan your courses, you can plan accordingly, alongside of the requirements for certification and licensure. So you have a human development course that counts. You know that you have a course on co-occurring disorders that counts. You take a course on trauma that would count towards licensure. So while you're fulfilling the requirements for your bachelor's, you're also putting these courses in your pocket for licensure later on down the line. And then what you're unable to cover in your degree program, you're able to cover later on down the line, either with graduate courses or with continuing education units that can be found online, anywhere from free to very affordable prices. So now that you know what the educational requirements are for the certification for alcohol and drug counselors, what are the supervised practice hours? So the supervised practice hours for this tier of certification are 4,000 hours of supervised clinical counseling practice. 2,000 of those hours must be direct service, so that would be direct one-on-one counseling with clients, group counseling, or family counseling. So direct service meaning directly providing service to the clients. The other 2,000 hours can be indirect service, which indirect service could be things like, writing your notes, meeting for group supervision, completing training, completing other responsibilities related to your work as a substance abuse counselor. So that could be completing forms for take-home medications. That could be completing assessments. It could include anything that is not direct counseling, basically. So if you're trying to come up with 4,000 hours to meet the requirements for this aspect of credentialing, it would take 2 years of full-time work to meet that requirement. Now, once you have your master's degree, although you still have to go through the process of the certification, it's a very quick process. And you also do have to complete this tier of the exam with the same examination board whose link is provided in the Moodle website. So if you already have your master's degree, once you begin doing substance abuse counseling, you're kind of a leg up because you already have met a lot of the educational requirements. And now at this level, at this tier, what I'm calling tier 3, you only have to complete 2,000 hours of supervised clinical counseling. So that can be done within 1 year. You still have to meet the 300 hours of educational requirements. You still have to pass an exam. You still have to have supervision, clinical supervision from a licensed alcohol and drug counselor. The main difference is that you have already completed a 60-credit master's degree program in a human services field, whether it's a specific master's degree in addiction studies or in counseling or psychology. Has to be within that category at this level. There's not as much flexibility with the master's degree as there is with the bachelor's degree. So then let's say you've gone through and you've finished all the requirements for the certification, you now have your master's degree, you have the 300 hours of education specifically related to the knowledge and skills required to be an alcohol and drug abuse counselor. And now, you're working at BART, you're a full-time counselor there, you have clinical supervision that's provided, you're working for a preferred provider, and you are able to complete the requirements for clinical counseling practices within 1 year's time. So while you're climbing this ladder, and while you're improving the skills you have to offer and enhancing your career, you're also helping a lot of people, and you're helping the community, and you're helping for people to step out of addiction, as well as facilitating counseling for the co-occurring disorders which unfortunately plague many people who have substance use disorders. So we're now at 11 minutes. I can only go to 15 minutes with this particular type of videoing that I have here. And so I just want again to go over the 3 tiers. The AAP certification, the alcohol tier 2 would then be the alcohol and drug counselor certification, which can be acquired at a bachelor's level with 2 years of work experience at a preferred provider. And then the licensing tier, which I'm calling tier 3, which occurs after one has completed a 60-credit master's degree program in the human services related field. And then if a person is super passionate about alcohol and drug counseling and addiction recovery, they could then move on to pursue certification as a clinical supervisor, which is super important because without clinical supervisors, none of us could get licensed. So that's the process in a nutshell. And if you have any questions about the pathways to licensure, please shoot me an email. I also want to let you know that if you're not 100% sure about whether or not this is your specialty area, but you would like to learn more and you would like to help the community, the Kingdom Recovery Center, Dr. Bob's birthplace, who is the founder of AA, one of the main founders of AA, is right here in St. J. You can go to the Kingdom Recovery Center or check out their link, which I've included in Moodle, and volunteer. Or maybe you want to go to some of their courses, or maybe you're just interested in joining in on an AA meeting for purely observational interest. It's a great organization to get involved with while you pursue your studies in the psychology and human services field. And I'm definitely an advocate for experiential learning. So when in doubt, get out there and get your hands into it. So I hope you enjoyed this video. I hope it's helpful. Let me know if you have any questions. Thanks so much, and have a super day.